But first, not since the days of the bubonic plague, I'll spit that out, and the Spanish flu, both which hit Australia hard in the first quarter of last century, have we seen a state in such a panic over a disease. Today, after recording another 64 cases overnight, 233 since last Thursday, the Victorian Premier mapped out his toughest lockdown measures yet in this pandemic. They include 10 Melbourne suburbs being locked down for at least a month, 800 additional Commonwealth staff being sent to the state to assist with testing, quarantine and logistics, while international flights will also be diverted from Melbourne for at least 2 weeks. They are not confident in their quarantine procedures. Plus, an inquiry has been launched into exactly that. But in a sign that Victoria may never be able to properly trace their infections, Daniel Andrews claimed this afternoon that 928 people have refused to be tested during door knocks of homes in hotspot suburbs.
I do feel obliged to inform you that in Broadmeadows and Keilor Downs alone, some 928 people refused to be tested. Now, I can't change that. That's happened. All I can do is encourage those people come forward and get tested today.
Well, all he can do is probably be a little bit more forceful about how unacceptable that is. Who would do that? The carelessness is breathtaking. The selfishness is inexplicable. This was first uncovered last week, you'll recall, when Vic Health said that 30% of those sent to quarantine hotels after arriving back from abroad refused to be tested as well. What chance does any government of any colour, of health department as well, what health department can handle something like that when citizens don't see the reason why it's that essential? It's essential to saving lives and tracking back where you obtained the virus. Now, in terms of borders, just one nervous Nellie State Premier remains, still curled up in the fetal position and hiding from those evil eastern states. South Australia's Premier Steve Marshall was so spooked by the virus numbers in Victoria, he banned the Garden State and 2 others, New South Wales and the ACT. His July 20 reopening promise was broken today. New South Wales and the ACT were supposed to get access to South Australia on July 20, but he couldn't even say that with any confidence. Now, it's partly understandable, given what's unfolding in Victoria, which they border, of course, to the east.
We haven't made a decision on that. It could be that we bring the ACT and New South Wales before the 20th, or it could be on the 20th, or it could also be delayed. It's unlikely to be delayed. They have done extraordinarily well. We are, as a nation, moving towards restrictions provided around hotspots rather than whole of nation borders, but in this instance we are just not confident that we can lift that border with Victoria on the 20th of July. But we will provide a firmer update with regards to New South Wales and the ACT later this week.
Look, I understand the fear over Melbourne suburban clusters, but the 20th was the date set for reopening to the entire country. Victoria hasn't qualified just yet, OK, but to keep New South Wales and the ACT barred is just madness. He didn't even know. Maybe afterwards, maybe on the day, maybe beforehand. There is no reason. Both jurisdictions should have access tomorrow, July 1, not at a date yet to be determined. This is a case of a group of state medical boffins in Adelaide with no skin in business, no skin in the economy, making decisions based on health only. They are trying to eradicate COVID-19 for their own boastful legacies. It's selfish and destructive. Meanwhile, finally, out came the Queensland Premier to, yes, reopen her borders, but not to everyone.
Tasmania, South Australia, West Australia, New South Wales, Northern Territory and ACT are all in a similar position to Queensland. So from July the 10th, people will be allowed to travel into Queensland after filling in a border declaration. This border declaration is to ensure that no one has travelled to Victoria in the past 14 days.
This could have happened long ago. They could have made the decision 2 weeks ago to open tomorrow. And all you've got to do is use all the clever medical tactics employed successfully in places that have done very well with the virus, like Taiwan and to a lesser degree South Korea. We could have had temperature checks at the borders, at the airports, the wearing of masks in high traffic areas such as public transport, and local lockdowns if outbreaks were to come about. It could have been done in a heartbeat, and it's now on the cards in Victoria. Meanwhile, in another example of how Australians need to live with this virus and maybe even more viruses, another potential pandemic has been identified. According to the BBC, it's discovered that a Chinese group of scientists have discovered a virus carried by pigs, but one that can also infect humans. The researchers are concerned that it could mutate further, spread easily from person to person, and trigger a global outbreak. No one is taking any chances. The scientists are warning that agencies need to take measures to control the virus in pigs and swiftly monitor swine industry workers. It is not the first time we've had diseases connected to the swine industry. It couldn't happen again, though, could it? Because I tell you what, we have all had enough.